I'd like to introduce our next doctor, Dr. Dan Rossignol. Thank you so much for being here.
Well, thanks for having me.
Well, obviously I know your history and all the thousands of families that you've helped, but for those that are watching, can you give a little bit of background about why you got so passionate into what you're doing and where you're practicing currently?
Yes, so I have two children with autism, and when they were diagnosed, for my older child, I didn't even realize that he had autism, so it was actually a shock to me when he was diagnosed. And looking back, I realized I didn't really get much training in my residency about autism, and I don't even know if I saw a child with autism during my training. So it was a surprise to me. And then we started going to other doctors for their autism care and not finding a lot of answers. In fact, we were told certain treatments didn't work, like the gluten-free, casein-free diet, and I took that at face value. But my wife decided to listen to other parents and started some of these treatments in our children. And my older child, for example, had chronic diarrhea that got a lot better when he went on this gluten-free, casein-free diet, which at the time I thought was kind of a crazy diet. So then I went to the library and reviewed literature, and I found about a dozen studies on the gluten-free, casein-free diet. And then I realized, you know what? I can't listen to other people. I've got to go look at research myself. And so my kids started to improve with these different treatments that were considered, treatments that aren't, as well studied and so forth, like supplements and diet. And so that got me interested, and I started going and researching and trying to compile this data and seeing what's out there as far as treatments. And it's because my two kids have autism that I started down this pathway. And I think God gave us two kids with autism for a reason, and it's to be able to help other people that are affected like we are.
And now where are you practicing currently?
So right now I have a clinic in Florida in Melbourne, and I have another clinic in Southern California and a smaller clinic in Northern California. So I'm doing that to try to reach more people, to have more families helped, because I can't see everybody. So I've hired some other doctors and nurse practitioners to help me to try to meet the need that keeps growing and growing as autism rates keep going up and up.
And I know they can go to, is it Rossignol Medical Center?
Yeah, so www.rossignolmedicalcenter, all one word.com. And they can find out more about our practitioners and our philosophy. I also have all the studies that we've written on the website as well that people can download.
Okay. And so now I know, obviously you and I know what autism is. You knew about what autism was way before, you even had children, due to the fact you're a doctor. I remember getting that diagnosis and really not understanding. They hand you this pamphlet,
right,
and it has a couple paragraphs about a neurological disorder, but past that, it doesn't really give any explanation. Right. So those families that are watching and they hear the word autism, often you might see somebody maybe on television, it's somebody that shoots baskets really well, right, or they sing really well, or they dance really well, which, as you know, every child is different. Right. So how do we define what is autism?
Well, it's important to know that autism right now is classified as a psychiatric disorder in the DSM-5, but we feel that it's really a medical disorder. So if you look at the underlying abnormalities that are present, we do find things like problems with the mitochondria, which are parts of the cell that create energy. A lot of kids with autism have inflammation. So the diagnosis of autism is based on basically subjective assessments. So the child comes in, is evaluated by somebody, and if they have impairments in speech, impairments in social, impairments in behaviors or repetitive behaviors, they might get the diagnosis of autism. But the important point is that this is subjective, and that's why some children will get different diagnoses from different providers. And it doesn't tell us anything about what's causing the autism. Why is the child not speaking? Why did the child lose speech? For example, some kids will lose speech if they have the onset of seizures. We find some kids that will have seizures, will treat their seizures, and then start speaking more. So what we're concerned about is not necessarily what the label is, because autism is essentially a label. It's like saying this is a black wristband and I could put it on my wrist. We want to know, well, how did it get black? How did it get that way? How did the child get autism? What caused it? Do they have a thyroid problem that's interfering with their speech and attention? Do they have seizures that are interfering with speech or causing repetitive behaviors? Are they having gastrointestinal problems that are then causing them to be aggressive? We want to identify those underlying medical problems and then treat those things, as opposed to just putting the kid on a medication to control their behavior or just doing therapy. The therapy is important, but what we want to do is try to improve brain function with the treatments, finding these underlying problems, and then treat that. All right. So whether you call it autism or developmental delay or something else, we're not in so much to the label. We're into figuring out why is the child that way, what is causing the problems, and then we can treat those underlying medical issues.
So basically, when the child gets a label, whether it be apraxia, developmental delay, autism, whatever, where do they go from there? That's also really confusing, because I know once you get that, or PDD-NOS, that's a fun pervasive development disorder not otherwise specified, right? It's a really fun, letters of a label. What are these families? I know when I got the diagnosis and it was like, okay, your child has autism. Okay, now what? Because if I go to the doctor and my child has a cold, or my child has an ear infection, they say, here's the treatment, and the child gets better. So I remember getting the diagnosis at first thinking, well, what do you mean my child has autism? Okay, I kind of already thought he did, but now you're confirming it. What's the treatment for it? So where's the first steps they go from when they get that your child has autism label?
I mean, most parents obviously going to start with a diagnosis somewhere, so the child is showing some type of delays. They go to the regular pediatrician or family doc, and hopefully they're sent on from there. What's coming out now is that some docs are not recommending further evaluation. They're saying just let some time go by, wait another 6 months, maybe the child will improve. And now we know that is just a delay in diagnosis. So there's a test called the M.C.H.A.T, M-C-H-A-T, that children can take at 18 months that flags them for autism symptoms. So that test should be administered, usually by 18 months.
Who administers that?
Well, it's usually a scale that parents can fill out, and then it's scored by the doctor, and then that red flags the child for, okay, there may be some autism symptoms here, and then hopefully they get evaluated and diagnosed quickly. What we focus on in clinic is, again, we don't care if you call it autism, developmental delay. If we have a child who has, for example, a speech delay, but they're not diagnosed with autism yet, we can still evaluate them, we can still test them for abnormalities, we can still treat them even without the diagnosis of autism. So we don't have to necessarily wait for that. And so what we want to do is we want to have these patients get into treatments quickly. That's both behavioral treatments, but also biomedical treatments, to see a doctor who can help diagnose these things. For example, when I told you my older child had chronic diarrhea, we took him to a mainstream GI doc to be evaluated, and the doctor told us that the diarrhea was from the autism, which didn't make sense to me. And this is before I even knew much about autism. And I remember asking the doctor, does my child need a stool test? He said, no, it's just the autism. Did he need a scope? No, it's just the autism. Well, later on, we found out that he had some abnormal bacteria in the gut. We treated it. He went on the gluten-free KSV diet, and his diarrhea resolved. So he had some underlying medical problems that weren't addressed. And so what we're focusing on is trying to train physicians to recognize these underlying medical problems in the children with autism and then treat it. So we do that right now. We have an organization called Medical Academy of Pediatric Special Needs, M.A.P.S. The website is www.medmaps.org, and it's a list of doctors who have gone through some of this training. So what we try to do is comb the medical literature, find things that have been identified as problems in children with autism, and potential treatments. For example, there's a large number, about 50 medications that have been studying autism, and about 25 different nutritional supplements. So these are things that may be beneficial for the underlying medical problems that these kids have. So we want them to get into a doctor quickly who can evaluate the children for this, test them for these abnormalities, and then start treatment. There's, of course, no guarantee that the kid's going to get better, but it's a starting point. And then obviously continue the behavioral therapy, because that's going to hopefully train the brain once the brain is improving.
Well, so often you hear families will say, my child has autism, and I'm just going to put my child in school, and they don't actually even think about anything to do with the medical part of it. So how do we really explain to those that are watching, that we believe, obviously, we're on the same wavelength, that our kids are sick in a lot of ways. And so, I feel like the general public just really isn't understanding there's all these other co-labels that are going along with that.
And again, like I said, the labels don't really matter too much as much. Of course, if the child has autism, then we know that they have a certain set of symptoms. But if there's any type of developmental delay, especially, say, for example, a teacher says your child's delayed, or we have to put them in a special classroom, that would be a red flag for, okay, let's get further evaluation. So when the CDC does prevalence studies, for example, and they go in and evaluate children in schools, they'll find a certain percentage, 30 to 40%, depending on the study, of children who have autism who have not been evaluated or diagnosed with autism to date. So they actually identify those kids. So there's a large number of kids out there that may have autism but haven't been diagnosed yet. So it's important, if there's some type of delay, to get further evaluation. Go to your pediatrician, your family doc, tell them that your child's delayed. If you're not getting enough response, go to another doctor. And that's what you do when you go out to eat dinner. If you go to eat dinner someplace and you don't have a good meal, you go someplace else. You go to a doctor and you don't feel like you're being heard, go see a different doctor. You can get another opinion.
And now, when you're looking at autism, I know I have friends that have young kids, and they get very nervous sometimes. They get scared. What are some of the characteristics, especially when they're young, that they might kind of think something might not be right?
Yeah, one of the first early signs of autism is that the children tend to look at your mouth and not your eyes. So it's one of the early signs. You'll see things like maybe the child's not pointing, the child's not interacting with people, maybe they have poor eye contact. Obviously, they may not have speeches coming out. Some kids will have repetitive behaviors where they might flap their hands or do some finger movements or have some repetitive noises they make over and over. Before my older child was diagnosed, he used to spin things on the floor, and he could spin things I couldn't spin, and we thought it was a cute little, kind of awesome
It's brilliant.
thing. Brilliant, right? And
Yeah.
it turned out it was a sign of autism. We just didn't realize it. So those type of red flags, if you start seeing those things, or nowadays the awareness of autism is so high that you'll have people, teachers, neighbors, say, "Your kids, do they have autism? Do they have a problem?" And so if you start hearing things like that, then you probably should have your child evaluated further. So even at a young age, you may see some of these signs. Of course, the thing with autism, no one wants their child diagnosed, right? So there's a tendency to maybe, ignore the signs or put them aside and not deal with them. And sometimes when their child's diagnosed with autism, or they get a medical test back that's abnormal, parents can get very upset, which is completely understandable. And what I tell parents is, look, your child's the same now as they were before we did the test or before the diagnosis. Now you know more about the child, so now you can do something about it. So it's better to identify the problem and start tackling it than to ignore it and let it get worse. And so the younger you can treat these kids, the better they're going to do generally.
Because I hear sometimes people will say, "Oh, well, my child points," but the child might be looking. They might be doing repetitive things. They might not be talking.
Right.
And in their mind, they've read somewhere that children with autism don't point. But their child does. And so I think it's important for families to know they don't have to have all these characteristics. They just might have a few.
The core features of autism are really social communication. So interaction, eye contact, all the nonverbal cues, and verbal communication back and forth, of course, so speech. And then repetitive behaviors or restrictive behaviors where they have one interest and that's it, where most kids will have multiple interests, or they'll have repetitive behaviors, things that other children generally aren't doing, like flapping hands is one of the most well-known ones, but some kids will pace back and forth, they'll make sounds back, repetitive sounds, things like that.
Or meltdowns sometimes.
Sometimes they'll have, just unexplained. And a lot of times parents start to notice that because they see other kids around their child at the same age, and they go, wait, my kid's not doing this, or my kid seems more irritable or more, anxious or whatever. That should lead to further evaluation.
And now where do they go? That's the other thing. I get a lot of people saying, well, my pediatrician doesn't really, they just say, oh, just wait, they're too young, they're probably fine, kind of thing. So, where does somebody go to get an evaluation?
Well, most of the time people are going to see a developmental pediatrician, a neurologist. The trouble is that there can be waiting lists and so forth. But if you're persistent, you can oftentimes find someone who can evaluate the child, or even a psychologist or someone who's trained in kind of knows the symptoms. Again, from our standpoint, from the M.A.P.S doctor standpoint, we're going to take the child and evaluate them medically and look at their underlying medical issues. So whether or not the child has a diagnosis yet is irrelevant to us because we're looking to see what's wrong, what's going on. So if the child is speech delayed but doesn't have a diagnosis yet, we're going to still look to see are there things that might be affecting the speech. And so that can be done even before a diagnosis is made.
And I think that's important for families because I think a lot of times moms, especially, I can't speak for dads, but I think moms, we have this kind of gut feeling where we know something's wrong, we're being told nothing's wrong, and we kind of just keep pushing it down. And so I would advise the moms when they get that kind of feeling, that's when you have to be really persistent and get on the phone. And
the mother's intuition is almost always right. So when moms especially come in and say, I think my kid is having this, that, whatever, rarely are they wrong. And they usually know. So you know your kid better than anybody. So when you go to the doctor and you feel like you're not getting heard, you should speak up. I mean, it's your kid. And if you feel like you're not getting your message across, speak up to the doctor or see somebody else. And if you're persistent, you can oftentimes break through, but you have to be persistent. And most doctors are very busy and they have a limited time with you, 5, 10, 15 minutes in the room, and they go on to the next patient. They're not going to go home and think about you. They might, but they probably won't. So you during that time, you really got to get your message across. And if you feel like you're not being heard, see somebody else. Keep pushing. And the people that are persistent are the ones that get answers and get more help more quickly.
And so now for that family that just got diagnosed, let's say they're sitting at home or they have a feeling that maybe, something's not right. Let's just put it that way. This isn't, my child's not developing typically. They're feeling helpless. They're feeling hopeless. What kind of message can you leave them with?
Yeah, I think the biggest thing is to be active, to push. It's your child. And if you think there's something wrong with your child, you need to push until you get the answers that your child needs. So you need to be persistent. You might need to see several different doctors. You might have to, push to get the evaluation. And a lot of times patients will go, and I used to be this way before I was a doctor. You go to see the doctor tells you X, Y, Z. You're like, okay, that's it. So when I older child saw that GI doctor, what did I do when he said it's just autism? I completely accepted it because I figured, well, I saw the expert, I saw the GI doc. He said there's nothing to worry about. You don't have to do a stool test, etc. It's just autism. And I didn't know that I should have pushed because I just thought, well, the expert said it, so it must be correct. So it's not that you have to question everything that the doctor says, but if you feel in your gut that you're not getting the answers, that you're not being heard, you have to persist and you have to go see somebody else. And you can certainly see a M.A.P.S doctor. You can go to that website and find a list of practitioners in your area. So if you feel like you're not getting heard and you want an evaluation of the medical problems that your child might have, then you can go there. And we see patients that come in that 18 months that seem to be doing pretty well, but parents just want to check in and they want to see there's something going on. There's something we can identify that might be helpful in their child. And so you can do that at any point as well.
I think that's very helpful. I think for families out there, there's education, there's resources,
right.
And it's all about, typing it in, getting on the phone, talking to somebody.
Right.
And if you don't get an answer, then find an answer.
And education is power. I mean, if you don't know, you can't do, right? So I think just people that are listening and seeing this podcast or whatever will have more knowledge, and they'll know, okay, maybe I need to evaluate my kid, maybe I need to be persistent, I have to push forward. After all, it's your kid, and no one's going to love and take care of your kid like you are, right? So you got to push for them.
Absolutely. Well, thank you so much, Dr. Rossignol,
Thanks
for
for having
everything
me.
you've done and continue to do for all of our kiddos.
Appreciate it. Thanks for having me.
Thanks.